Good afternoon, everyone. Thank you so much for taking the time out of your day to join us for our webinar. My name is Michelle Hahn, and I am the Community Programs and Events Manager for HealthLinks. And I really love the job of coming together with all of you and hosting these webinars each month to learn more about how our partners and our business community are working together to improve the health of individuals and workplaces. And I'm very excited for our presentation today because part of our goal at HealthLinks is to connect businesses to each other so that they can share their stories and support each other in creating an overall culture of health and safety. So today we've invited our recognized healthy business leader, the City of Fort Collins, and they also won the 2017 Governor's Award for Workplace Wellness. So we're very excited for them to share their story with us today, and we have their wellness program coordinator here. But before I hand it over to her and give her an introduction, I just wanted to go over a few housekeeping items for you. So first, I just wanted to let everyone know that we will be keeping you on mute throughout the entire presentation. That helps us eliminate any problems with our technology and sound and feedback. So if you have a question or need anything, please just feel free to use the chat box that is on your control panel, which should have popped up when you logged in to join us today. I will also be sharing a follow-up email with you all. It'll have a link to a recording of this webinar so that you can share it with any of your colleagues or friends that you might think would benefit from listening to the presentation. And it will also provide you with additional resources. So a copy of the presentation along with some of the items that Angie will be sharing today. And in that email, there will also be a link to take a quick survey. So if you don't mind giving us feedback, we love hearing from you, and it helps us really improve our webinars and find other presenters that can give you the resources that you need. So with that, I'm going to give you an introduction to our presenter. So Angie Rhodes is the Wellness Program Coordinator for the City of Fort Collins, and she promotes programming that supports employees and their families in their journeys toward healthier lifestyles at work and at home. Angie is full of a lot of passion and fun, and every time that I've had a conversation with her, I can tell that she puts a lot of care into everything that she does and really values her employees and the work that she does for the city. So we're very excited to have her here to share her story and the story of just the journey that the city has taken to build their culture today. So without further ado, Angie, I'm going to hand it over to you.
All right, thank you so much, Michelle. And I would like to say I admire all of the work that you and your entire HealthLinks team do. We are going into our third year of working with HealthLinks, and we appreciate the amount of support and guidance that we have received from you guys in these past 3 years. It's absolutely amazing. So thank you, Michelle. And hello, everyone. Hello. I want to welcome you to our story of the City of Fort Collins Wellness Program, and I hope that you are having a fabulous day so far. I want to start by saying that winning the Governor's Award last year was absolutely exciting and rewarding, and one of the reasons is it has given us the external validation that what we are doing at the City of Fort Collins is the right thing with our wellness program, and this kind of gave us the momentum to keep going and keep providing this amazing programming for our City of Fort Collins employees. So I'd like to start with a little bit of gratitude. I'd like to first say thank you to all of our employees at the City of Fort Collins, those of you that support our program. Our employees, they are amazing. They encourage us, they inspire us, they want us to deliver the best programming that we possibly can. And in doing so, they provide us with continuous feedback. They don't hold back. They let us know how we can improve, and we totally appreciate that. I also want to express gratitude to all of our managers and leadership. They support us and they believe in us, and they allow their employees time to participate in our programming and focus on their own personal wellness journeys. And we cannot do this programming without their extensive support and leadership. I also want to express gratitude to my amazing team. I am in awe every single day that I get to work with you, and I get to create such effective programming with you. So thank you so much. And finally, I want to thank all of you for being here on this webinar over your lunch hour today with me. I am honored that you have chosen to spend your time listening to our story of the wellness program journey at the City of Fort Collins. So thank you, everyone. We're going to start with a little bit of a history lesson. Our wellness program began in HR in the 80s. We've had a program for many, many, many years. So in the 80s, in HR, it was kind of a small initiative, fun events put on by the staff. It was mainly fitness-based. There were things like the race against the city manager, which you can see a photo of on your screen. They had walking races. They had an annual health fair. It was a pretty good time, I have to say, from what I hear. I was not in wellness at the time. They also then created a program called Sweat Bucks. And Sweat Bucks was a program where you could earn bucks, like dollars, for recording your physical activity minutes. I was around at that time, and it was absolutely amazing. I got cash for writing down when I went skiing, when I cleaned my house, when I went for a run. It was a ton of fun. I can't complain. So that was how we started. Then in the 90s, our utility department hired a wellness coordinator. Our utility always has and still prides themselves on being innovative and progressive. So they were one of the first to go out and hire a wellness program coordinator within our area. This coordinator, she was amazing. She started to look at all aspects of health and safety within only the utility department. She brought together our first on-site fitness room. She brought on on-site health or on-site yoga. She brought on health screenings and fitness testing, and she also helped start a team that collaborated with our safety department and many, many more wellness programs. So then we moved to the early 2000s. The utility department was so amazing that other departments within the city heard about this wellness program, and they wanted to participate as well. So in the early 2000s, the wellness coordinator moved over to HR and ramped up the citywide programming for all employees across our organization. A wellness specialist was hired, and she got to hang out still over at the utility because the utility did and still does favor having a wellness presence within their own department. So now that the program went citywide, our city or our signature program, the Well Days program, was imagined and brought to life. So in the very beginning, our Well Days program was a paper tracking program. In this tracking program, you had to set a wellness goal, you had to participate in the health assessment, you had to attend training, you had to get your blood pressure checked, and you had to participate in the disease management program if you were identified for that program. So we even for a little while made it mandatory to go to our health fair, which we no longer do that piece of it. So let me continue. About 5 years ago, our program grew once again. We got to hire a third member of our team. Excuse me, I apologize. So every year our programming changes bit by bit, and because of the feedback that we get from our employees, we've built more on-site fitness rooms, we've delivered more classes like training for a triathlon or healthy cooking, journaling, stress management. Classes are no longer mandatory. We offer more on-site fitness classes, even at remote sites. And we've seen an increase in ergonomics. We've seen an increase in sit-stand stations for our employees. So thank goodness we were able to hire this third staff member to help support all the initiatives that we had going. So still today, we are a staff of 3, and we support 1,500 employees. We do grow to around 2,500 employees during the summertime, but mainly we are around 1,500 employees. So in addition to our 3 paid staff, we have a group of volunteer staff that we get each semester from Colorado State University. We rely heavily on these students to support our programming and support our students, and also they get the extra added benefit of seeing what corporate wellness is really like. So we typically get 3 practicum students, which are very part-time. They do about 5 hours a week. And then we also typically get 1 full-time intern. So They're invaluable to our program, and I highly suggest that you look into getting practicums or interns. And if you need contact information for the Health and Exercise Science Department at CSU, I am more than happy to share that. They are an amazing program, and they produce some of the best students coming out of that program. I really would like to share them with you. So also, our Well Days program continues to grow and grow. Right now, it is more robust and supportive of our employees no matter where they are at on that personal health journey. This program is not a one-size-fits-all. There is something in there for every employee no matter where they are at on that journey. So we really take strides to focus on each employee on where they are at and helping provide guidance and support for what exactly they need. So I look forward to sharing with you some details about our Well Days program coming up here in a few minutes. But first, I want to share that with the growth of our program over the past 30 years, our leadership support has always been strong and supportive. That has been a true backbone that has made our program to what it is today. We are grateful for this continued support and guidance, and our leadership is truly talented, and I appreciate them every day. So in front of you, I'm sharing with you the city's vision, mission, and values. And I feel that it's important to share this with you because a tremendous amount of work, a tremendous amount of time has gone into creating this framework for our organization. And I believe it is one example of how supportive our leadership is to our wellness programming. So at the city, our vision is to provide world-class municipal services through operational excellence and a culture of innovation. So in order to reach that vision, we've got a really strong supporting mission as well as strong supporting values. So here you can see our values are all listed out, and I listed them here so that you can more easily read them than the previous slide. You can see that safety and well-being do support that journey to being world-class. So next, I'd like to show you a video that we show our new employees. Our employees are working every day to be world-class. We want to have world-class employees, we want a world-class organization, and a world-class community. So as a wellness team, we're here to support our employees in that journey. So in the video, you're gonna see the employee perspective as well as the community perspective on being world-class. And you will see that we do have a strong support role for all of our employees. You will also see that our wellness program is a huge value within our organization.
The City of Fort Collins views its customer service as world-class. It's important that we're serving our community to the best of our abilities. For me, that means that every person that walks through the door, I'm making a personal connection with, and I'm giving them my undivided attention. I love that I get to touch people's lives every single day. I get to know our community members, and I get to figure out what they really need from us in order to give them a happier and healthier life. So making that connection and introducing them to things that they didn't even know existed is what makes my job worth it for me.
Basically, I chose Fort Collins because it was Fort Collins and a great place to live in 1981 before I picked a place for business, because this is such a great town. I decided to open up a Ben & Jerry's scoop shop in 1996. The business has been very good to me here. And I would say in the last 10 years, Fort Collins has gotten even better because of the leadership in Fort Collins and the commitment to make it a great place. A lot of thought was put into the structure of Fort Collins a long time ago. And none of this stuff happens overnight. It takes 20, 30 years for a town and a city to get to this level. And when it gets to this level, everybody wants to be here. The economy thrives. More people start businesses. And just the climate in general is business welcoming.
The city has a very strong commitment to wellness. In addition to facilities like this with exercise machines and free weights, there's also our wellness program, which is composed of awareness, activities, and behaviorification, which would include offerings like group exercise classes, healthy cooking classes, stress reduction, and preparing for retirement. The way that the city has designed the wellness program, that provides a lot of flexibility. So whether you're doing things before work, or during the day, or after work, or researching stuff online and getting points for quizzes to educate yourself, all of that gives a lot of flexibility to work it in with however busy your schedule is. Like I take a class 3 days a week, and it's in the middle of the day. It's easy to fit into my schedule, and it allows me to take a break from work, release my mind, be active, and then allows me to be more productive when I get back to work in the afternoon.
I love Fort Collins, and I love Fort Collins for a variety of reasons. I think that we are incredibly taken care of as citizens. I know that response time to emergencies, be that flood or snowstorms or whatever, is going to be quick and efficient, and it's going to be well done. As a former CSU student, I believe that the relationship with campus is a phenomenal relationship and really propels us forward. We get great minds that come into town. We are innovative because of that, and we're not the same town that we were, or city that we were when I started on Colorado State's campus, and that's a beautiful relationship. As a business person, I love that we're supported by the city. I love that that we have a voice. I love that we have a way to connect and continue to grow as a business and grow as a city. So I don't know what's not to love about Fort Collins. I think it's pretty much all around an awesome place to be.
So now you've seen the amount of tremendous support that we receive as a wellness program. And so I'd like to get in a little bit deeper into some of the aspects of our program itself. So the nuts and bolts of our wellness program is called Well Days. This is a incentive program where employees can earn vacation days for participating. It's been growing and morphing into this amazing program for the last 14 years. And I kind of highlighted that a little bit earlier. Excuse me. So currently, our program provides guidance and resources for our employees where they're at on their personal health journey. This program is open to all of our employees. It doesn't matter if you are on our benefit plan or not, it is open to everyone. If you are eligible for our benefits, then you get to earn the vacation time. And you are also eligible for prize drawings at the end of each trimester, what we call trimester. If you are not eligible for benefits in your employment status, you do still get to participate, and you are eligible for the prize drawings only at the end of the trimesters. This is an 11-month program. Employees can participate for any amount of time within those 11 months. And it is a points-based program with a few mandatory components kind of mixed in there, but it's not nearly as mandatory as it used to be. So we break down our program, our 11-month program, into 3 trimesters. They're 15 weeks each, and each trimester does have a focus and a mandatory component. In each trimester, the employees have to earn 300 points in order to earn their well day. So every year we spend a significant amount of time looking at our program, looking at our focus areas, looking at our mandatory components to make sure that this is still working for our organization. So for 2018, I'd like to share with you that our first trimester, the focus area is called check-in. And this is really where we want employees to take time to check in with themselves. Get to know your blood pressure. Take your health assessment and really get a snapshot of your health. Maybe go to your annual exam and visit with your doctor. Maybe get your health screening done and then take those screenings to your doctor and have a discussion about those. So it's really a lot about checking in with you and how you are doing as a whole. Then in the second trimester, we move into what we're calling Make Your Move. And this is where we want employees to dig a little deeper and think about what they learned in the first trimester and start making a goal and start making some moves and figure out what action you wish to take to make some lifestyle changes possibly. Or if you feel like you're absolutely on top of it and doing awesome, how can you maintain these amazing lifestyle choices that you are making? Then we move into the third trimester, which we're calling Find Balance. So employees have checked in, they've set some goals, and now we want them to try to figure out, how can I balance these changes that I've made? How can I keep perspective on what I've learned? How can I maintain those goals that I have set in the second trimester? And it's a balancing act. How can I keep this going and sustain this program and sustain these changes that I've made? So, and I mentioned, along with each focus area, there is a mandatory component. So when you're checking in, the mandatory component is our annual health assessment. And we do want you to get to know your blood pressure, especially with the blood pressure changes that just came down. In the second trimester, our goal this year, or our mandatory component this year, is going to be setting a wellness goal. Something thoughtful regarding what you learned in the first trimester. And then in the third trimester, we do make the post-program survey the mandatory component in order to earn your Well Day. So really quick, I'd like to go over our Well Days points. I did mention that you have to earn 300 points each trimester in order to earn a Well Day. And that 300 is broken down into 3 categories: activities, awareness, and behaviorcation. So activities are things like gardening or working out or attending a road show, maybe even getting a massage. So those are all activities based. Awareness examples include the health assessment, knowing your blood pressure, any preventative screenings. Let's say you get a mammogram, let's say you get a skin cancer check. Those are all things that bring awareness to you and your health and well-being. So that's our awareness category. And then finally is our behaviorcation category. And yes, this is a made-up word for behavior change and education. And when we came up with this word, we just felt so passionate about keeping behavior change and education as one category. And this is really where employees have to dig deep and make some changes, make some effort into their own personal health and well-being. So this is where employees can attend a training and get points for that. They can do some online trainings. They can, let's say they're a smoker, they can earn points for quitting smoking. Or if you're a never ever smoker, we do give you bonus points for being a never ever smoker in the behaviorcation category. So after today's webinar, one of the things that Michelle is going to send out to you is the brochure of our 2018 Well Days program. And when you get that PDF of our brochure, feel free to reach out and ask any questions that you may have regarding our wellness or our Well Days program. So this screen kind of shows you some successes with the Well Days program. We do look at our Well Days versus participants versus non-participants and our health claims. So you can see the blue are folks that do not participate in our Well Days program and their average cost of health claims. In the green, you can see our Well Days participants and their average costs of claims. They're significantly lower, and we're pretty excited about that. This is one more graph, the last graph I'm going to show you for today, and it's some of our participation numbers. And we've had a lot of successes within our program, and this is just one small little snapshot of the successes. So you can see our participation increases since 2009. The blue, the dark blue, is our health assessment. You will see a drop from 2014 to 2015 in our health assessment, and that is, we believe, due because we switched vendors for our health assessment, and our 2017 numbers are not on there quite yet, but we did see an increase in our health assessment in 2017 as well. Our light blue is the Well Day registrants, and in 2017, we finally broke the 1,000 mark, so that's exciting. And then the green is the total number of Well Days awarded, and every year we seem to be rewarding and record number of Well Days. So it's absolutely exciting and rewarding to all of us. So Right now, I'm going to go through a few fun things that we attribute all of our successes to. So as a team, we really believe in being high touch. We want to be in front of our employees. We want to hear their stories. We want to get out there and see them and talk to them. We want to share the good news about our program, and we want to hear any feedback that they have back to us face to face. So every year we go out on a roadshow and we try to visit as many departments as possible. And one year we created this roadshow video that I'm going to share with you right now. And it's just another fun way of sharing all of our information out to our employees.
Offering a comprehensive benefits package, superior programs, and a world-class culture, the city's Benefits and Wellness team has a robust program that offers numerous avenues to City of Fort Collins employees to manage and maintain their health. The Benefits and Wellness team knows that healthy employees create the foundation of our community's workforce and preserves one of our most precious resources, our health status. Boasting a wide array of benefits and a nationally recognized wellness program, the City of Fort Collins puts the health of you, the employee, at the forefront of every workday. Our wellness program had a record-setting year last year. Well Days enrollment was up, Well Days awarded were at the highest ever, our health fair attendance was outstanding, and our Great Holiday Way and flu shot programs were highly successful. Our annual marathon health assessment is a great way to be proactive about your health and wellness and earn rewards just for participating. Some of the top risk factors identified from the assessment are: the cornerstone of a great day is a good night's rest. The National Sleep Foundation has found that half of all insomnia is related directly to stress. Stress has been linked to headaches, depression, and many other conditions, including obesity. Obesity can put you at risk for many preventable conditions, including heart disease, diabetes, and cancer, as well as things like high blood pressure and high cholesterol. The Marathon Health Assessment is a great way to identify these risk factors and is the first step on a path to a healthier, happier you. In addition to the great wellness program, many benefits are in place to facilitate you and your family's health and wellness, like family status change. You have 30 days to add or subtract dependents from your plan. CityCare is a no or low-cost on-site clinic for employees and their families. Free generic prescriptions for medications prescribed by your doctor. Free well care. All preventative care is covered 100%, including physicals and well care visits. Urgent care is only $40 for after-hours health care at any in-network facility. Flexible spending. Carry over up to $500 on flexible healthcare spending. Employee Assistance Program offers 8 free counseling sessions for family and individual counseling and is covered at 100%. And reimbursed massage or acupuncture up to $500 annually. And with 4 on-site exercise rooms and reduced rates at 5 other recreation centers, there are countless ways for you and your family to stay active and healthy. As an employee of the City of Fort Collins or a family member, these programs are offered to you. The goal is that you will make the informed decision to actively get involved and promote this benefit to your colleagues and your family members. With such comprehensive programming and an ever-changing healthcare market, the Benefits and Wellness team knows that you may have more questions. We offer a variety of information located on the HR tab on CityNet, and if you have a question that you cannot find the answer for, please feel free to reach out to one of the members of the Benefits and Wellness team. We look forward to helping you stay happy, healthy, and well.
So as you can tell, we love sharing videos at the City of Fort Collins. So I believe another part of our success comes from our surveys. So in order for employees to get into the Well Days program, they have to register. And when they register, immediately pops up our pre-program survey. So last year we had over 1,000 employees register for our Well Days program. So therefore we had 1,000 employees take our pre-program survey. And since we have their undivided attention at that time, we use that time wisely and we add in our needs assessment questions as well as our wellness culture survey questions to that survey. And we do get a pretty fantastic snapshot every year that we can look at for our programming. Then, as I mentioned earlier, the post-program survey is mandatory in order to earn your third well day for well days. So we typically get around 700, even more this year, responses to that post-program survey. And along with the survey, we do have comment areas, and employees can share anything that is on their mind regarding our program. And this year, we had over 75 pages of comments that we read through. And we read through these and we talk about them and we kind of grill through them as a team, trying to figure out what changes do our employees want? What are they trying to tell us that they want in our program the next year? They love to share their thoughts, and I truly believe that they share their thoughts because they know that we are listening to them. So another fun thing that we do is we share an infographic every year. We started doing this a few years ago, and we share all of our data in this method from the previous year. And it's just kind of a fun way to look at all of our numbers instead of a bunch of charts up on a screen and whatnot. So we do share this at our annual supervisor safety and wellness breakfast. And then we take those and we ask the supervisors to share those infographics with their team members. We even post them on all the bulletin boards, and we share this at any opportunity that we possibly can. We really want employees to see the effectiveness of our program and the results of our program. We don't want to hide it and keep it just to ourselves. So with that, Michelle also has a PDF of this 2016 infographic. It's the one that we shared with our employees last spring. And she is going to email this out to you all after today's webinar. So another thing that we do is we have found an incentive that works. And every year we do our annual health assessment. And we provide a $50 gift card to any benefit eligible employee who takes our health assessment. And it's been such a great incentive for us that we see 90% rates of participation in our health assessment. I also have to mention that we do incentivize spouses with a $20 gift card. We don't see quite the same effect with the spouses, but that is one of our challenges, and that is definitely one thing we continue to look at every year moving forward. We've seen success through selfies, and I kind of giggle because this was fun. I mean, selfies are all of the rage. So one year, our health assessment, we were not getting up to our goals. We were not quite there. And Calvin, he's the gentleman in the yellow shirt with a sweatband. He was kind of all over our marketing campaign for our health assessment. So at the end of our campaign, kind of close to the end, we decided to take Calvin and send out a thank you card and a sweatband to everyone that had already completed the health assessment. When these sweatbands started showing up in people's inbox, we also asked them to take a selfie of them in their sweatband and send it back to us. And yes, we would give them points for it, but we got a ton of selfies in return. And then what was even cooler is employees who didn't get the sweatbands were starting to ask, well, where's mine? And how do I get one of these? And how do I get to take a selfie with my sweatband on? So we did, in fact, end up hitting our health assessment goal that year because of Calvin and our wellness sweatband selfies. We do believe in celebrating our successes, and the first year that we successfully hit our health assessment goal, we decided to go out and send a thank you card to every single employee who had taken time to participate in our health assessment, because we could not do these kind of things without their support and their participation. So we celebrate our success as well as their success. One thing we do every trimester within our program is hosting a mini incentive program. And we usually only host one at a time, sometimes two, but it's typically only one at a time, and they're 4 to 6 weeks long. We like to enlist our interns and make this their project so that they can kind of see a program from start to finish while they are with us. And you should see the amount of creativity that these kids have. We typically get participation rates around 150 to 300 employees participating in each of our mini incentive programs. And we do heavily award points for these mini incentive programs. So right now, our longest standing and most successful program is the Great Holiday Way. And I'm sure you've all kind of heard of programs like this, but it is a weight maintenance program throughout the holidays. It is managed by my coworker, Danny, and he does a fabulous job. What we do, this last year we did hit a record with 55 teams and 360 employees participating. So he had to wrangle all of those employees and get them on the scales together, get them all weighed in, get their pictures taken, and get their fun team names. He had quite a task ahead of himself. So, and that's how we make it fun, is we do ask teams to name themselves. And so you can see our Broadway stars, our Noel, it-alls, those are our folks from IT, and put down the fork. So with these mini incentive programs, what we see is there's higher accountability and then camaraderie as we go through these short-term programs. So the next piece I want to talk about is collaboration. A lot of our successes come from collaboration. We don't have all the ideas. We don't have the bandwidth to provide everything to our employees. So we do rely heavily on collaborating with other departments within our organization and even outside organizations. So I'm going to touch real quickly on a couple of our collaborators. Mentioned in the video was our on-site health clinic, City Care, and that's an on-site clinic available for all employees who are on our health plan. And that staff is truly amazing. They help provide newsletter articles every month to us. They provide a monthly lunch and learn session, which is open to all employees. You do not have to be on our plan in order to attend that session. And then they promote all of our wellness programs within their clinic. We have a strong relationship with them and truly appreciate everything that they do for us as a team. The next organization that I'd like to highlight for collaboration is Larimer County. We've collaborated with them on initiatives for, oh my gosh, a number of years. It's been quite a while. And we still continue to collaborate with them on our annual health fair, blood drives, and even just sharing of program ideas. So to highlight one item, it's our annual health fair that we collaborate on, and we get a participation level of around 1,000 city and county employees coming through the health fair to see over 110 vendors or so. It's a huge celebration that day of both safety and wellness, and we all come together to bring this to our employees. And finally, I'd like to highlight our safety, security, and risk management department that we collaborate with. We collaborate in a number of ways throughout the year, but one of the biggest ways is through our city safety and wellness team. And I've been on the team for 12 years, and I've watched it grow from this small information-only sharing group where they had to bribe everyone with burritos to come to the meeting. So small conference room, not a lot of people with burritos. So now it has turned into this amazing, robust group of employees full of ideas and initiatives. There's still info sharing going back and forth between various departments. There's feedback, there's storytelling, and it's now this safe environment where we can talk and learn about safety and wellness, and then those employees can in turn take that information back to their groups about what they've learned on the team. So it's invaluable, and I am so impressed to see how it has grown and gained momentum over the years. So a couple challenges. We've seen a lot of successes, but we do still have our challenges that we're facing. And I'm going to discuss just a couple of them here really quick with you guys. So a big one for us is programming to our spouses. We really want to reach our spouses. When we program to our employees, they might, learn something new about nutrition or cooking or fitness at work. And then they go home, and if the support's not there for what they just learned, what's going to happen to what they just learned at the workplace? So we really are trying to reach out to our spouses as well. They are truly valuable in this wellness journey. So our spouses can attend any of our on-site classes. We even save seats for them in the classes. If they don't come and take those seats, then we turn and open those up for more employees to attend. Spouses can attend our annual health fair. I do realize, though, that our health fair is during business hours, and it is hard for some spouses to break away during the day to get there. And then spouses can attend our flu shots and health screening clinics and even more. So there are opportunities where spouses can get involved. Just getting there is our greatest challenge. So a few things that we're trying with spouses is we're collaborating with City Care, and they help us send mailers home to our employees and their spouses about events that are coming up. We've tried to do that, but it seems more successful when our clinic staff does it themselves. And then this year, we're trying something new where we're collecting email addresses from our spouses so that we have a direct line of communication to them, and we can share any upcoming events or opportunities that we think they would like to participate in. And so that way, the employee doesn't feel like they have to always be sharing the information. We really would like a direct line to our lovely spouses. And the last one I want to share with you is our challenge of our hard-to-reach populations. So we've got departments spread out all over town. We've got departments that are out in the field during the day and not around computer access. And there's some departments that just don't have any flexibility whatsoever within their work schedule. So one I'm going to focus on really quick is our bus drivers. So their barriers are location, because one, they are on the south side of town, and then they're driving all day. They're limited by time, again, because they are driving a bus. They are not in front of a computer screen and so therefore they have limited computer access. And our program is computer-based. So last year, we started spending a significant amount of more time down at their bus depot. We've been down there during shift changes for things like blood pressure checks. We bring them our road show. Sometimes we just go to be down there at shift change in case there's any questions that are coming up. We brought in an outside vendor to bring a stress reduction mini program just for their staff on site. And we've even brought our health coach from our on-site clinic down there to have some hours doing on-site health coaching with that staff, since they cannot get to our on-site health clinic on the other side of town during the day. So we're working through these challenges. We're still trying to figure out how to solve them. We are not forgetting about them, and we are trying to be higher touch down with these harder to reach populations. So today, I'd like to close with an expression of gratitude for my team. To create such a robust program and work through all of the challenges and successes that we have with this program, we tackle everything as a team. And each of us has unique and amazing strengths, and together we are one force you cannot even reckon with. So every year every year we look at both of our successes of our program and our challenges of our program, and we try to celebrate those successes. We try to celebrate those together in a timely manner. And those challenges, we really try to work through those together and find ways that we can move forward through our challenges. So as a team, we work and we play, we learn, we volunteer all together. And I believe that is why we are able to create such an amazing and successful wellness program. So here is my team. That is Lynn Sanchez on the left. She's our wellness program manager. Danny Nelson, our wellness program specialist, is on the right, and I am there in the middle. All of our email addresses are there listed for you because we are all three of us here as resources for you. We can answer any or all of your questions to the best of our ability. So I just want to thank all of you for spending this time with me today, and I hope the rest of your day is fabulous.
Thank you so much, Angie. That was wonderful. You provided a lot of great tidbits, and it was great to understand the journey and get to know some more about what you guys are doing that's been so successful at the city. So for those of you that are still on the call, we still have time for some questions, and I have some that have come in already, so I'll ask Angie on behalf of all of you. But if you have other things that you want to ask, we have the time, and again, I'll include the contact emails in the follow-up that goes out as well, so you can get in touch with Angie or the rest of her team one-on-one as well. But first, Angie, just for clarification, for some of the numbers that you provided in your graphs, at the beginning of the presentation, you said that you serve 1,500 employees, but the numbers on the graphs show some response rates and participation that's higher than that number. So can you just clarify your staff structure again and let us know how many people that includes?
Yep. So our staff structure does get pretty confusing. We do have 1,500 employees, and we do fluctuate up to 2,500 employees in the summertime. And sometimes our numbers are, we'll see higher participation rates because our program is open to all employees on some level, regardless of your level within the organization. So we typically focus on 1,500 because that's mostly our classified and full-time hourly employees, and it's our part-time hourlies and our seasonal hourlies that really bump us up to that 2,500 throughout the summer.
Great, thank you. And another question is, what part of your wellness programming have you found to give you the biggest bang for your buck, or what would you recommend people implement to give you the biggest bang for your buck?
Oh, that's that one's a tricky one, because our data collection, our health assessment is really, we put a lot into our pre-program survey, our health assessment, and looking at our health claims, because that's really what drives our focus of our programming every year. So for us, it's looking at the data. For our employees, it is definitely our Well Days program, because for our employees, they really enjoy earning those extra 3 days of vacation time every year.
Yes, that does sound like a great incentive. And then, are you self-funded in terms of insurance, or do you have a provider?
We are self-funded.
Okay.
Excuse me, I'm sorry, you guys. We are self-funded, and if you have any questions regarding our benefits, my supervisor, Lynn Sanchez, I showed you guys her on the screen. She was interim benefits manager for quite a while and has a great understanding of our wellness program and benefits and how they are so well intertwined together. So if you have questions, please reach out to her. She is a wealth of knowledge.
Thanks. And another question, what advice would you give to someone who is just getting started with programming, might be at kind of a plateau and not sure what next steps to take? What do you recommend is the one thing that somebody should do when they walk out of here today?
So I'm going to recommend two. I know they asked for one, but I'm going to recommend two. One is really use your resources, meaning, the other organizations on this phone call. HealthLinks has a robust program that can really help you and focus in on your program and look at what is missing and where you need to go. The second thing I would say is stop and listen to your employees, because your employees are going to be the ones to tell you what they want in a program, what they want to see, and how they are going to be willing to participate. So I can program all day until I am blue in the face, and try to throw something out there to our employees. But if I don't fully understand them and what they want and what drives them, my program's not going to go anywhere. So really stop, take a deep breath. It's all going to work out for the better, and listen. So that is my advice.
Thank you. That's awesome. And thank you for your kind words to HealthLinks. Yes, our team is definitely here to help everybody and just try to help provide resources that you might need to fit the unique needs of your workplaces. I did want to shout out again back to something that Angie said in her presentation of utilizing student interns. We have a lot of businesses that have connected with practicum programs through the different schools, whether it's at CSU or UNC has one, and then here at the School of Public Health, we also have one as well. And it's helped a lot of people move forward, because I know a lot of people you may or may not have your own wellness team, or if you do, it's always nice to have extra hands. So definitely reach out to Angie for that contact information if you want to connect with a student and have them come work for you. And then you can contact me personally too, for if you're local in Denver or south of here, for some positions as well. And I know that we have some people from the mountain regions on the state, and I'm sure that people would be willing to drive out to your neck of the woods to help out as well, because they just need to get the hours and want the experience. So it's definitely a valuable resource to connect with. Anybody else have any questions for Angie while she's on the line? I'll see if a few more trickle in, but as you leave here today, I just wanted to remind you that I will be sending out all of the resources that Angie mentioned on the webinar and all of the contact information in case you want to get connected. And there will be a recording that you can share with others of your team if you would like. And in addition, just a reminder, if you would like to be in the running for the Governor's Award for this year's Culture of Health Conference, you do need to be recognized as a certified healthy business leader through our program, and your application has to be submitted by the end of the day today. So if you've already submitted one so the eligibility dates run from March 1st of 2017 until today. So if you're recognized in the leader category from March of 2017 through December of 2017, you're in the running already. So, but if you have more questions and need clarification for that, you can email me directly. All right. Thank you all for your time today. Thanks for being here with us. Angie, thank you so much for taking your time to put together a wonderful presentation and just to share your knowledge and resources with everyone here today and the rest of our network. We really appreciate it.
Thank you, everyone.
I don't see any other questions coming in, so I'm going to let everybody get back to your day. Have a great afternoon.